Well, switching gears, it's Mommy Monday, and we have something important to talk about. Trinity Health of New England is launching a new initiative meant to spread postpartum awareness and care for new moms.
Yeah, this is such a great idea. Dr. Carrie-Ann Silverman is the chair of the Women and Infant Service Line. She's here to tell us all about this maternal bracelet program. Thanks so much for being here.
Thanks so much for having me.
So this is very interesting. You were just explaining to us while we were listening to Mark's package here, but this is hopefully going to be a statewide initiative, right?
Right. So, maternal mortality across the nation has been increasing, as many of your viewers might know, and certainly as obstetricians know. The rate has been increasing in the U.S. We got some good data in 2023 that showed a decline, but the U.S. leads the industrialized world in terms of maternal mortality. There's been a lot of effort in trying to figure out how to combat that. And this is an initiative where when women are admitted and they give birth, before they leave, they're asked to, or they're given an orange bracelet that says, I gave birth on it. And they're asked to wear it for 12 weeks so that they have a visual cue to remind themselves that they recently gave birth, but also urgent care, pediatricians, mental health providers, OBGYNs, ERs would also have a visual cue that mom's symptoms need to be taken in a different context because of the recent event of birth.
So you get it, the bracelet, you wear it. If some complications arise, you have to go to the hospital. They're going to know, okay, this mother recently gave birth, so I'm going to start looking at maybe some different things that could be going wrong, right?
Correct.
Like what kind of problems arise after birth that could be some red flags?
Great question. So headaches, visual disturbances, elevated blood pressure, chest pain, shortness of breath need to be taken in a different context because maternal complications that arise after giving birth can present in ways that are different. And so having that visual cue is really important for providers to think, oh, this mom has a headache, but she actually gave birth. She might have postpartum preeclampsia, for example.
Okay. Wow, interesting. So you had mentioned that it's a visual cue not only for those mothers, but I think probably mental health is such a big issue postpartum, right? That you want to make sure that you're getting proper care.
Correct. Leading cause, one of the top 5 leading causes of postpartum maternal mortality relates to mental health disorders. And so patients who recently gave birth, who are anxious, who are nervous, who aren't sleeping, who are depressed, that complaint needs to be taken within the context of recently giving birth. And so our hope is, if moms are wearing this is a visual cue to a mental health provider, for example. A mom might forget to mention that, but perhaps this can clue the mental health provider into thinking about it differently.
Yeah, I feel like in our country, moms are kind of expected to get right back to everything after giving birth, right? In other countries, it's not quite like that. You have some time to recover both mentally and physically. But for us, it's not really like that.
Correct. And so that pressure on mom is tremendous, and they might seek help, and again, hoping that this will help other people see and connect those two dots for mom and guide them in the right direction.
So you're asking for new moms to wear these for 12 weeks.
Correct.
And this rolled out initially at St. Francis.
Correct.
So across the board, if you're traveling throughout the hospital system there, you can see those orange bracelets, right?
Correct, but I also want to stress this is a statewide initiative. So the hope is that all birthing hospitals within Connecticut will roll this program out by the fall of 2025, so that before moms who are giving birth in hospitals go home, they'll have this and they'll be able to wear it. And if that does occur, Connecticut will be the first state in the country to have all birthing hospitals on board with this program rolled out, which would be great.
Great.
Yeah.
Oh my gosh.
What
Good
a
for
fantastic.
Connecticut. Yeah.
Yeah, really proud of our state. I'm really proud of all the hard work. I mean, this is a ton of hospital work, nursing work, physician work, first responder work. There's a lot of education that goes into this. So really proud of our state.
So I want to just go back really quickly because I feel like research is probably showing that for so many women, it goes beyond that 12 weeks.
Correct.
Is that something that they can continue to do just to remind themselves that they're still going through
We'd like moms to wear it for up to a year because the reality is postpartum complications while less likely after 12 weeks of postpartum period are less likely, they certainly can continue, particularly those cardiovascular complications, but also mental health complications. So we're really hoping that moms will wear it for up to a year. We're really advising them to stick with it for 12 weeks because I think that's the most impactful period of time for them. But certainly wearing it longer is not a bad thing. And if we could get people to wear it for a year, that would be great.
Yeah. Great. And how can we find out more information?
You can go online to Trinity Health of New England. You can also use CHA, which is the Connecticut Hospital Association, which has also been really trying to garner support for this. And so their website could probably point you in the right direction.
Very good.
Yeah,
so
thank you
that's
so much.
right up on your screen, trinityhealthofne.org/orange. And you can check them out on social media as well. For more information, you can go to Nicole's podcast, Mommyhood Unscripted. Dr. Carrie Ann Silverman, thank you so much for sharing. This is valuable information.
Great. Thanks for having me.
Thank you so much.
Really appreciate it.
Hey, Marcy, let's send things out to you.